It's been a while. I've just been so busy with residency, but I just wanted to make sure I made some nice educational videos for you that will hopefully be helpful. I just wanted to talk about some of the basics. There are a lot of bread and butter conditions in neurology, and one of them is headache. Now, interestingly, headache can get quite complex, and that's what I find to be so intriguing about headache medicine in general. Usually when you think of headache, you think tension headaches or migraines, but there are so many different headache conditions like occipital neuralgias, trigeminal neuralgias, SUNCT, etc. And it's just so beautiful, the plethora of headache conditions that are out there. And I think what's even more beautiful is the fact that we can do so much for a lot of these patients who are suffering from headaches. That's also part of the reason why I love to treat patients who have different headache conditions, because I just feel so happy and satisfied when I see them doing so much better than before. As a headache sufferer myself, I understand just how debilitating headaches can be. It really affects your function and even how you feel as a person. Headache conditions can be quite severe, and to be able to do something about it to help patients be pain-free or at least close to it is just so incredibly fulfilling. In any case, let me just talk about some of the basics for you neurology residents out there, or residents in general who come across patients who come to the emergency department or are inpatient for headaches. What are some questions that you need to ask them? First and foremost, ask them to describe how their headache is, because like I said, there are many different headache conditions. So ask them specifically what they are experiencing. Where is the headache localized to? And I'll ask my patients to point to where it typically hurts. Is it bifrontal headache? Is it more along the occiput? Is there some neck pain that's also associated with it? Because you can have cervicogenic headaches too that can even overlap with, for example, some migrainous features as well. So don't think that just because a patient has one type of headache that they don't have another overlapping headache condition that you may potentially be able to treat. So ask them to describe their headache. What is their pain rating? For example, what is the pain rating on average and what is it at its worst? And how are they feeling right now regarding pain on a scale of 1 to 10, with 1 being approximately no pain or very little pain and 10 being a lot of pain, like very severe. And that way you can compare their baseline pain rating to how they're feeling now and generally how severe their headaches can get. So it gives you a sense of how controlled their headaches are in terms of pain. Ask them about the quality of their headache. Example, is it pressure-like and band-like a tension headache? Or is it pounding or piercing, stabbing? Is it an ice pick type of headache? Do they feel pain anywhere else? For example, for cluster headaches, people feel like they have a stabbing sensation around the periorbital region. The other thing you should ask them is how long do the headaches last for on average? So for example, some people say, oh, I'll have a headache lasting for approximately 3 hours and then it resolves on its own. Or my headaches can last even more than 1 day. And ask them how long it lasts with and without medication for headache. For example, typically it can last for 3 hours without any medicine. But if the patient takes ibuprofen, for example, they may say that when I take ibuprofen, it goes away about 30 minutes later. Also, make sure you ask your patients about the frequency of their headaches. How often do you get a headache? Is it a once in a month thing? Is it you get it 2 times a week? Is it every single day? And that also helps you to classify the headache. For example, if we're talking about migraines, if someone's had more than 15 headache days per month over, let's say, 3 or so months, then you can call it a chronic migraine headache versus something that's more episodic. And there are different durations and frequencies to particular types of headaches as well. Ask about associated symptoms. For example, do they have any lacrimation or rhinorrhea? Do they have a migraine with aura where they're having an aura on one side of the body, like numbness or tingling on one side of the body, maybe in an atypical pattern, or weakness on one side of the body, etc.? What are some associated migrainous features that they may have? So ask them, do you feel photophobic, phonophobic, nauseous, like you're going to vomit when you have these headaches? Or do you have those type of symptoms for any of your headaches for that matter, because again, people can have multiple different headache conditions and sometimes it may overlap. Make sure you ask about red flag symptoms too. So for example, do they feel like when they're coughing, it elicits the headache or makes it worse? Or when they're bearing down like Valsalva, it makes it worse? Or do they feel like it's a thunderclap headache where it's extremely severe, thinking along the lines of subarachnoid hemorrhage? Or is their headache positional? For example, if someone has a CSF leak, they'll have a headache when they move to sitting or standing position. So remember to ask about different red flag type of symptoms. Another thing to ask is what their headache history is. Learn a little bit more about their headache history, the quality of the headaches they've had in the past, the severity of it, what kind of medications they've tried for it, if they've tried any migraine type of medications or any other medications for their headache for that matter that they've been prescribed, and compare it to their clinical presentation at present. Also ask if they've seen a neurologist before for their headaches and what was recommended. Have they ever gotten an MRI of the brain before and what were the results, if they can recall any. If they've had any traumatic brain injury in the past that required, for example, imaging, or they ended up in the hospital, or had a concussion, or lost consciousness, or any motor vehicle accidents that may have occurred that could potentially relate to their presentation, because patient can have post-concussive syndrome as well. Another thing to think about. It's also important to note what dosage of the headache-related medications they've tried in the past and how long they've been tried on those medications. I've come across a good handful of patients where they said they've tried all of these different type of headache medications, but they've only tried it for a week or two. And some of these medications take weeks and maybe even months to really truly see a benefit. So they have to give it a fair chance. But at the same time, you also want to check to see if they had any side effects to those medications, because not all patients stop their medications just because they don't want to take meds, or maybe they felt like after a day or two they didn't see an effect and they were expecting to see a benefit or a clear benefit earlier on. Sometimes people have side effects to certain medications. So ask your patient about that. Maybe it's income related issue where they weren't able to afford certain more expensive migraine medication, or maybe it was an insurance issue, which happens a lot, unfortunately, but you won't know this unless you talk to your patient. There's also medication overuse headache, which is also why you should ask your patient how often they're taking certain medications for their headaches. If they're taking ibuprofen and Tylenol every single day for the past couple of months and they're having headaches, sometimes they can end up having medication overuse headache as well. So again, proper history taking is important. Well, you can also ask your patient if they know about any brain tumors that they were ever diagnosed with, or if there's anything like that that runs in the family, if migraine headaches run in the family. Ask them how long they sleep for every night. Do they get continuous sleep? Is it broken sleep? If it's broken, why are they waking up? For example, is it just to urinate? Is it that they have poor sleep hygiene in general that you should educate them on? Is it something else that's keeping them awake that maybe you could help them with? What is their diet and lifestyle like? Are there certain foods that can trigger their headaches? Sometimes people who consume dairy products or alcohol even can end up having headaches like migraines as well. Maybe they've been very stressed out. Ask them about any recent emotional stressors that have been taking a toll on them. So it's important to know the triggers. Thankfully, there are so many different medications that can be used to treat headache conditions. So there's a lot that you can do for your patient, but you have to first figure out what specifically is going on with your individual patient. And the way to do this is by getting a proper history and doing a proper physical exam as well, and diagnostics. In addition to that, just to make sure there aren't any other potential causes for headaches. So I hope that helps. I just wanted to go over some of the basic questions that you may ask your headache patients, but if you're interested, I could go into more detail about various headache conditions. See you in the next one.